Emrelis, a targeted therapy for non-small cell lung cancer. Are you or a loved one facing non-small cell lung cancer, NSCLC? Understanding your treatment options is crucial. This video provides a comprehensive overview of Emrelis, a targeted therapy offering new hope for patients with specific types of NSCLC. Emrelis, also known as telisotuzumab vedotin-tllv, is a prescription medicine used to treat adults with non-squamous non-small cell lung cancer, NSCLC. It's specifically for cancers that have spread locally or to other parts of the body, metastatic. This medication is designed for patients whose tumors exhibit high levels of c-Met protein overexpression and who have already undergone prior treatment. Emrelis is administered intravenously by a healthcare professional every 2 weeks. Emrelis received FDA approval on May 14, 2025, under accelerated approval based on overall response rate, ORR, and duration of response, DOR. Continued approval may depend on further verification of clinical benefit in confirmatory trials. Currently, there is no generic or biosimilar version of Emrelis available. Emrelis is an antibody-drug conjugate, ADC, a sophisticated type of medication that targets cancer cells directly. This targeted approach aims to minimize damage to healthy cells, reducing the severity of side effects. The drug consists of 2 key components: an antibody that seeks out cancer cells with the c-Met marker, and a potent cell-killing agent called MMAE. This dual action is what makes Emrelis a targeted therapy. The antibody component of Emrelis binds to the c-Met markers found on the surface of cancer cells. Once attached, the drug is internalized into the cancer cell, delivering its payload directly to the source of the problem. Once inside the cancer cell, MMAE is released. MMAE disrupts the cell's internal structure, specifically the microtubules essential for cell division. This disruption prevents cancer cells from multiplying, ultimately leading to their death. Like all medications, Emrelis can cause side effects. It's important to be aware of these potential effects and to communicate any concerns to your healthcare provider. The most common side effects associated with Emrelis include fatigue, decreased appetite, and swelling in the feet, ankles, legs, or hands. These side effects are generally manageable with supportive care. Emrelis can also cause abnormal laboratory test results. These may include decreased white blood cell counts, increased blood sugar levels, and increased liver enzyme levels. Other potential changes include decreased levels of phosphorus, sodium, red blood cells, and calcium. Emrelis may also impact fertility in both females and males. If you have concerns about fertility, it's crucial to discuss these with your healthcare provider before starting treatment. While many side effects are manageable, Emrelis can also cause serious side effects that require immediate medical attention. It's crucial to be aware of these potential risks and to report any concerning symptoms to your healthcare provider promptly. One serious side effect is nerve problems in the hands or feet, known as peripheral neuropathy. Symptoms can include numbness, tingling, burning sensations, pain, muscle weakness, and difficulty walking. Report any new or worsening symptoms to your doctor. Emrelis can also cause lung problems, which can be severe, life-threatening, or even fatal. Seek immediate medical attention if you experience new or worsening lung symptoms, such as cough, trouble breathing, fever, or wheezing. Eye problems are another potential serious side effect. These can include blurred vision, dry eyes, sensitivity to light, eye pain or swelling, and eye redness. Your healthcare provider may recommend an eye exam if you develop any of these symptoms. Infusion-related reactions can also occur during Emrelis treatment. These reactions can be severe or life-threatening. Symptoms include itching or rash, shortness of breath, flushing, chest discomfort, fever, back pain, chills, headache, nausea, vomiting, and feeling faint. Prompt medical treatment is essential to manage these serious side effects. Your healthcare provider will monitor you closely during treatment and may adjust your dose, temporarily stop treatment, or permanently discontinue Emrelis if necessary. Before starting Emrelis treatment, it's crucial to inform your healthcare provider about all your medical conditions. This includes any history of nerve problems, lung or breathing problems, eye problems, or liver problems. It's also essential to inform your healthcare provider if you are pregnant or plan to become pregnant, or if you are breastfeeding or plan to breastfeed. Emrelis can harm an unborn baby. Females who can become pregnant should undergo a pregnancy test before starting Emrelis treatment. They should also use effective birth control during treatment and for 2 months after the last dose. Males with female partners who can become pregnant should use effective birth control during treatment and for 4 months after the last dose of Emrelis. It is not known if Emrelis passes into breast milk. Therefore, breastfeeding is not recommended during treatment with Emrelis and for 1 month after the last dose. Emrelis is administered intravenously by a healthcare provider. The infusion typically takes about 30 minutes. The medication is given once every 2 weeks. Your healthcare provider will determine the number of infusions you will receive based on your individual needs and response to treatment. It's crucial to inform your healthcare provider about all the medications you are taking, including prescription and over-the-counter drugs, vitamins, and herbal supplements. Certain medications can interact with Emrelis and increase the risk of side effects. Always consult with your healthcare provider or pharmacist to check for potential drug interactions before starting any new medication while receiving Emrelis. The active ingredient in Emrelis is telisotuzumab vedotin-tllv. Inactive ingredients include histidine, polysorbate 80, and sucrose. Hydrochloric acid is added to adjust the pH. Emrelis is available as a lyophilized powder in single-dose vials containing 20 mg or 100 mg of telisotuzumab vedotin-tllv. It is manufactured by AbbVie Inc. in North Chicago, Illinois. This video provides general information about Emrelis and should not be considered a substitute for professional medical advice. Always consult with your healthcare provider to discuss your specific medical condition and treatment options. Your healthcare provider can provide personalized guidance based on your individual circumstances and help you make informed decisions about your care.